think we're rolling. So, good afternoon. My name is Jessica Price. I am currently a Master's of Public Health student at Indiana Wesleyan University. I'm doing this presentation today on emergency preparedness and disaster preparedness for vulnerable populations. As you know, I am also serving my practicum hours here currently as the Disaster Cycle Services intern, where I've been able to learn a lot about Licking County and how our disaster services impact the community. So, I'm gonna go ahead and start. For this presentation, I'm going to focus on 4 separate areas of preparedness. First off, just how preparedness and public health interact with each other. Secondly, vulnerable populations specific to disaster preparedness. I'm going to talk a little bit about the public health core competencies that are relevant to preparedness, and then also public health initiatives that the American Red Cross specifically have related to disaster preparedness for community members. All right, preparedness defined is on this slide by FEMA is the continuous cycle of planning, organizing, training, equipping, exercising, evaluating, and taking corrective action in an effort to ensure effective coordination during an incident response. The National Health Security Strategy, there's an illustration there for you on the strategy, guides the development of the Healthy People preparedness objectives through a framework of stakeholders of national security to build community resilience, strengthen and sustain health emergency response systems, and improve capabilities and prioritize resources. There's some statistics on the next slide related to preparedness. 46% of adults aged 18 years or older have emergency household plans that include instructions for household members about where to go in the event of a disaster. 20% of survey respondents from the Department of Health and Human Services surveys reported having disability that would affect their capacity to respond to an emergency. And then 1 out of 4 of those 20% made arrangements specific to their disability to help them respond safely in the event of an emergency. Healthy People 2020 has a target for the year 2020 to obtain 51.2% of households to have emergency preparedness plans. Healthy People 2020 also has 5 objectives that outline their goals for preparedness for the year 2020, dealing with community resilience, countermeasures to protect communities, early detection and prevention and mitigation of emerging threats, and that includes not only everyday health preparedness, but national security as well. And then the one that I am focusing mostly on is detecting, prevention, and response to disasters and public health emergencies on the stakeholder side of things. So, preparedness and public health. Health disparities is defined as preventable differences in the burden of disease, injury, violence, or opportunities to achieve optimal health that are experienced by socially disadvantaged populations, or in other words, vulnerable populations. Some of these examples for health disparities would be racial, ethnic, or socioeconomic groups, geographical locations as well, and some negative health consequences that are more likely to affect these individuals and related to preparedness is deliberate attacks, accidents, and natural disasters. Vulnerable populations specifically are groups within the general population that are more likely to develop problems as a result of an exposure or a selected risk to have worse outcomes from health problems than the population as a whole. So these vulnerable populations are children, since they're not able to manage on their own if they're very young, individuals with physical or cognitive disabilities, and then also older adults who might have cognitive or physical disabilities as well. Public health core competencies and preparedness. There are several different core competencies of my public health program that are relevant to preparedness. Social and behavioral sciences is first. It incorporates research and practice in an effort to support prevention strategies and education for populations, and thus reduces the risk of exposure to possible threats. Epidemiology encompasses the study of causes and controls of infectious disease epidemics. Preparedness goals currently strive to prevent and mitigate adverse health consequences that could arise from lack of sufficient preparedness infrastructure. Environmental health relates to this proposal as information collected deals with disaster preparedness plans that often the safety and status of individual homes and communities involve. And then disasters have the potential to impact populations on a large scale. Health administration and management, as well as health policy, requires the collaboration of federal, state, and local agencies to respond to public health threats, as well as take a proactive approach with preparedness efforts. Healthcare professionals and health policy entities should also use an interdisciplinary approach in addressing disaster preparedness, and therefore these core competencies are relevant for this presentation as well. Finally, going to move on to the American Red Cross and its initiatives that it's currently taking for preparedness efforts. I'm going to focus on three programs specifically that the Disaster Cycle Services team works with: the Ready Rating program, the Hands-Only CPR program, and the Sound the Alarm program. Each of these programs help to improve the national objectives for public health, as well as locally assisting the Licking County community. The Ready Rating programs first. It is important to prepare for possible disasters and other emergencies. Natural and human-caused disasters can happen at any time. There are three different ways that people can plan and prepare to make a difference and be ready in the event of a disaster, and I'm going to go into those a little bit later, but basically it's going to be making a kit, making a plan, and then being informed. The Hands-Only CPR program is a CPR program, training program, that deals with CPR without mouth-to-mouth breaths, and it's recommended for teens and adults who are seen out and that may collapse suddenly in an out-of-hospital setting, such as a home or at work or in the park, wherever. And this training program goes over the 2 steps that individuals can do to help administer CPR hands-only. The first is calling 911 or sending somebody to call 911 immediately, and then pushing hard and fast at the center of the chest. So again, those are 2 easy steps that the Red Cross trains individuals on for preparedness purposes. And then the last program is the Sound the Alarm program. On average, 7 people die every day from home fires, mostly impacting our vulnerable populations I was discussing, such as children and adults, elderly. 36 people suffer injuries as a result from home fires every day. Since this program launched in 2014, approximately 474 lives have been documented as saved due to this program. Over 1.5 million smoke alarms have been installed, and over 620,000 households have been made safer. So going back to talk about how you can help yourself and your family and loved ones involving disaster preparedness would be first making a kit and having your basic supplies available. Non-perishable foods, waters, flashlights, specifically special items if you do have any sort of medical needs, need to have electricity for some reason, having a generator would be important, medications and things like that. Other special items are listed here as well, such as baby supplies and pet supplies. And then additional items you might want to consider would be based on the types of disasters that occur in your area. The second step is making a plan. Meeting with your family and household members is essential to making a plan. You want to plan what to do in case of an emergency, choosing 2 places to meet if you get separated, choosing an out-of-area contact person in the event of an emergency. And then you want to practice how you're going to evacuate. Decide whether or not you want to go to a shelter, or if you have special needs, if you need to make accommodations for that. Practicing your evacuation plan, or at least walking through it 2 times a year, and then planning ahead for your pets, because we all know pets are important. And finally, the last step that you can do to help is being informed. So you want to learn what disasters are going to be relevant in your area. In our area, specifically in Central Ohio, home fires is a big one, tornadoes and floods. How are you going to be notified by the authorities of a disaster? You want to know the difference between watches and warnings and take proper action when there is a notification. Know how to protect yourself in your home if you're traveling. You want to have a member of your household trained in first aid and CPR, and then preparing emergency contact cards for all household members and always carrying it with you. And that so far concludes my presentation on disaster preparedness, vulnerable populations, and what you can do to be prepared. So does anybody have any questions? Yes.
Earlier you said something about older adults. What's considered an older adult?
An older adult. So technically the definition of an older adult, I think it's CMS does this, but would be 65 or older. So anybody who would be a Medicare beneficiary would be considered an older adult. Is there anybody else have a question?
What seems to be the best methods to reach out to the most vulnerable populations in our community as far as getting this information in their hands?
Sure. So that is the number one question. I'm actually studying that right now in my practicum. And basically, we don't want to wait around for people to need the information, so we want to try to integrate our education and processes and a more proactive outreach approach to those populations. So my background is in long-term care, basically just knowing that there are regulatory guidelines for preparedness for a lot of those types of entities, and home health, if you're a certified home health provider, that you have to meet a certain requirement and be able to prove that for your certification and payment. So as a Red Cross member, knowing that those individuals are going to need education or need information for that, and being proactive with reaching out has probably going to be the first step for that. So I think that answers your question, but yeah.
Very good.
Does anybody else have any questions? All right, thank you.